to the world. Subscribe now to the Hot 97 YouTube channel. It's Ebro in the Morning with Laura Stiles and Rosenberg.
Ladies and gentlemen, it's Ebro in the Morning. Laura Stiles, Rosenberg on the program. Dr. Marilyn Fraser and Steve Vixamar. Am I saying it right?
Correct.
There you go.
Yes.
Let's start with you, Doctor. Who do you represent and why are you here?
I'm from the Arthur Ashe Institute for Urban Health. I'm the CEO. The Arthur Ashe Institute was founded by Arthur Ashe, and we are partnering with IMG, Independent Medical Group, to do some work in terms of linking things together. So we provide the education, they provide the clinical testing and so forth. So we are coming together to partner, and we just wanted to talk about that today.
And you work for IMG Helps.
Correct. My name is Steve Vixamar. I'm the COO and co-founder for IMG Helps. And what we do, like Dr. Marilyn just stated, is that we do testing and treating for HIV, hepatitis C, and STDs in the underserved community. Today, we're primarily in Florida, but with this partnership, we're bringing some of our services up here and vice versa. We have 8 brick and mortar clinics and 15 mobile clinics. So our whole mandate is to bring the services out to the community.
Now, in the area, we often see, what are those, what are they called? The
blood drive.
Mobile testing sites?
Mobile testing sites,
Correct.
but also the clinics that you can just
City
show up to.
MD?
Yeah.
City MD, there you go,
Yeah.
City
Yeah.
MD.
Correct.
How is this different than like a City MD and those things?
So for us, what we primarily focus on is the Black and Brown underserved community. One of the biggest challenge that we have, which is the great partnership with the Arthur Ashe Institute, is the stigma around education. I saw a couple of interviews of you guys talking about hepatitis C and these different things. We find that the stigma and the education around getting tested and the risk factors is the biggest thing, right? So for us in our mobile units, we don't really advertise HIV or STD testing. We just say free health screenings because people don't really want to talk about HIV and STD. So when they get into that mobile unit, we start talking. We have a list of questions we typically would ask someone, and then they identify that they're at risk. And then is when we kind of get into sexual health, because sexual health is still taboo. And it's ironic. I'll go down my soapbox about hip hop and sexual health, how we over sexualize everything today. And it's great because being, from New York and 80s baby, we never really talked about sex never had those conversations. And I'm Caribbean too, so that's definitely
A whole other layer.
Whole other layer, right? So I love the transition that we've in today. Like everybody want to be poly, you have multiple girlfriends, which is great and open. Everybody want to talk about that, but no one talks about the risk that comes with all of that, right?
Right.
So that's one of the challenges that we face, right, when going out in the community, because everything is so overly sexualized. It's like, okay, that's great that you're open, but let's wrap it up, though.
I think it's so important because I hear from my friends who work in education that a lot of the sexual health programs are one of the first ones to get cut.
Yeah, those
first
are
ones to
first
go.
to get cut. And so there's no
So
education,
wild.
and there's everything happening. And as you mentioned, the risk factors, nobody wants to talk about that. And then the stigma that's associated with it. And it's surprising, like after all these years that we are talking about HIV, that people still think that, okay, if I take a glass from somebody else that has HIV, I may get that. Or if somebody's safe, if there's a safe girlfriend or whatever, she's safe no matter what, no matter whether she went out there or came back. She's considered safe, so then I wouldn't use protection with her. So there are all of these different things around risk factors that people don't talk about, even navigating condom use or something. People don't want to talk about that.
It's literally the most basic education that we think, like, what do you mean? But Ebro, like when I speak to my friends who are teachers, their mind is blown on how all of it is taken away.
Right.
Especially in underserved communities.
Yeah.
Like it's just lack of education. And culturally, like you brought up your Caribbean parents, not everyone feels safe to talk about it at home. Or their parents are not educated either.
And unfortunately, Black women are probably the highest at risk between, I think, the ages of 18 to 24, 25. It's even lower than that. I mean, because of the fact that, no one wants to necessarily talk about it, right? But yeah, it's bad that those services are the first to get pulled. So for us, all of the services we provide is absolutely free, right? So, they provide a lot of the education. So it's one thing to tell everybody, but it's the other thing to actually get tested.
What's going on in my head is, am I considered an 80s baby? What am I? I grew up in the 80s. Like my formidable years. In 1990, I'm 15 years old.
I know, but being born in 75.
What does that make me? Well, the only reason I bring it up is because when I was listening to records and, hip hop specifically in 85, 86, right? Boogie Down Productions, the J, the I, the M, go and get your Jimmy hat, strap it up. All of that was just in the music. That was common to be like, yo, you got, you know, and
it was.
I went to talk about it. You know, when we was going out to, and we knew we was about to get something tonight. It was like, yo, did you go to the store? You got to like. It was a common convo to make sure. Even the stupid part, like. We kept condoms in our wallets. Like that was just, and it wasn't until years later that was like, no, you can't do that. No, that's bad. Don't keep a condom in your wallet. It's not gonna work for you. But we didn't know, but we thought that was being prepared.
Right.
You know what I'm saying? So it's interesting to hear you say that.
Yeah, but
I'm so far removed from it. I have an 8-year-old daughter, so I'm about to be back in it.
Oh, man. Listen, I have a 16-year-old daughter. Trust me, I'm in it right now.
Right, but because I hear people talk about STDs, and I hear people talk about wearing protection. I see on social media women talking about wearing protection, and this, I see it.
But it's
I think
also
I'm
so
seeing
big
it.
Right now, we're hearing so many records now where people are showing off about having unprotected
sex. Exactly. So what I was going to say,
that's true.
Let's shoot up the club. Shoot up the club.
Oh, right.
So that's what I was going to say, Ebro. You mentioned that, the 80s, but the music from the early 90s on, you don't hear that today. No one's talking about that. I mean, most people are talking about shooting up the club and having multiple. I mean, no one talks about it like they used to.
Multiple girlfriends.
Right, and that's like the cool thing to do, which is, like I said, it's great that the conversation is opening, but have a conversation about protecting yourself too.
Yeah.
The Arthur Ashe Institute for Urban Health has been around how long?
30 years this year. 30 years. I mean, Arthur Ashe founded it just 2 months before he passed away, and trying to address health disparities, health inequities. As I said, also one of the things that we want to do is increase minority representation in the health professions.
Right.
Yeah.
And if people want to engage with the Institute, if people want to reach out, if people are looking for ways to
partner with us,
or even just to learn about professions in your world.
Yes, definitely. You can go on our website at www.arthurasheinstitute.org, and also you can just call the institute up as well. But we go out into beauty salons and barbershops, and we go out into the community, meet people where they are, and train barbers and stylists so that they can give the messages to their customers, because people trust their barbers and stylists more than they do their doctors. Right?
Now, do you guys get invites? Because this is interesting, right? We talk about what's being in the music, but I see a lot of podcasts of people sitting around, women and men, talking about sex, like sexual habits, the taboo sex, their craziest, blah, blah, blah. You see these clips online. Are you guys being engaged by these people to talk about the stuff you're talking about, or does that ruin the fun? Like, you guys don't get invited on these podcasts to talk about sex, because then it just ruins the fun. Now you want to be responsible.
Right, now you want to be responsible. We talk about, like, one of the crazy stats we talk about is, like, the STD rates in colleges, right? People don't talk about that. Like, 25% of the STD rates happen on college campuses, right? So with our mobile units, you figure last year, I think it was 20 million somewhat STDs nationwide, 5 million of them on college campuses, because it's crazy. So, yes, it does take the fun out of it when you start talking about that type of stuff. So, no, we don't really get it.
So we get invited to the stylists or barbers that would say, you know what, in our salon, they're talking a lot about this. Can you guys come in and kind of guide that conversation, or let us guide the conversation? So we get invited in terms of that.
Listen, if you work on a podcast or something out here and you talking about sex, y'all need to invite Dr. Marilyn Fraser and Steve Vixamar on, because I think this is something... I see, look, on social media, there's women writing books about their orgasms.
Right.
There is a huge convo out there about women and the lack of information women have about their own bodies, how their bodies work, how pregnancy actually works, sexual health, having orgasms, all that. But it feels like as a part of that convo is also safety.
Exactly. And even people knowing about their body parts, right? And knowing how it works, as you were mentioning, when we talk about prostate cancer, making sure that men know why to do a digital exam, because that's where you can feel it and so on. And yes, so people can get an understanding of how their body work. And that's important.
And listen, we've come a long way with health and with medication and with all of this stuff. So it's definitely a different environment today where people don't realize they're scared to talk about it, because, like you said, growing up in the 80s was kind of like faux pas. You think you're going to die if you catch HIV or if you get AIDS. It's not that case anymore. It's definitely a different environment. There's definitely a lot of medication, a lot of treatments out there for people. Matter of fact, there's a medication, I'm not here to promote it, but there is a medication prep that you can take that actually prevents you from catching HIV. right? So when we talk about that, people think, oh, well, I'm not gay, I don't need to take that. Well, no, it's not just for the LGBTQ community. You could be a heterosexual and take this medication.
And that also doesn't mean that you don't need to protect yourself.
Exactly. But that's another form of protection too. So like, yes, you could do that. Also wear condoms and stuff like that. So
yeah, I remember my first HIV test.
Yes, so all of our services are free. Like I said, we have the 8 brick and mortar clinics, 15 mobile clinics. We're bringing some of those services up here, but it's absolutely free. No insurance. It doesn't matter. We're willing to test and treat.
You guys raise money?
Yes, so we do raise money. I mean, our goal is to try to save 10,000 lives next year. So yes, we do raise money. You can go to imghelps.org and obviously to the Ashe Institute.org as well. And yes, we're obviously accepting donations. You have the sports ball tomorrow.
Yeah, we have
our
tomorrow we have our fundraiser, and it's going to be the 28th one, and it's at the Pierre Hotel in Manhattan, and that's where we raise funds to support the work.
Yeah, I was just saying. I remember the first time I had my first HIV test, and I went in. I was like 18, I think, and the nurse calls, hey, the doctor wants to speak to you for the results.
You're like, you couldn't just tell me right here. I got to go to...
I know live felt like I was on hold for half an hour.
Right.
It was probably 5 minutes. It was the longest 5 minutes of my life.
Exactly.
Everyone's been there.
Well, that's only because only the doctor can give you the results.
Yeah, no, I get it. But come on, fam. Why we got to have other...
Well, you have to go through a process.
I feel you. I feel you. Listen, we appreciate you guys coming by. Give it up one time. Dr. Marilyn Fraser, Steve Vixamar. Look up the Arthur Ashe Institute for Urban Health and also imghelps.org. There you go. Thank you very much.
Thank you so much.
Yeah.